It is Monday, April 1st. It's not a joke. No kidding. I am running late. For some reason, I was thinking I didn't have to be there till 8:30. I don't know why. But it's just after 7, I think. And I think I have to be there at 8. I am so confused. I'm so lost. I was just kind of wandering around thinking about, I wonder if everyone remembers we have a sim today, because we didn't get like any reminders or like, hey, make sure you're in this room at whatever time. We haven't heard anything, so I'm all spaced out. So yeah. I don't even know. Hopefully they're a little lenient on us because it's our last sim. I don't know. I really don't know. But in terms of sim today, we're working with like cardiovascular problems. So I don't know exactly what we're gonna have, but I was hoping to get, I thought I was leaving early, y'all. I really did. I thought I was leaving early. I thought I was gonna have extra time to review things, and no, I am actually leaving late, I think. So I'm actually gonna make this kind of brief because I want to make sure that I don't get too frantic. But yeah, it's our last sim. This is week 12. I've been working on my study guide all weekend. I'm still not done. Oh my gosh, this is, I redid the way that I'm doing my study guide for our exam on Wednesday from the way that I've always done it in nursing school, because I didn't do so hot on the last one. So I thought, okay, let me revamp the way I do my study guide, and it's still taking forever. I don't have a clear, concise way of making a short study guide. I don't know how to do it. There's too much information, so many things you have to know, and I don't know what they're gonna ask, and I can't figure out a way to make things short. So I gotta remember not to go that way. But that's not today. That is Wednesday. So I'm gonna go ahead and get going onto the main road, and I'll catch up with you guys later and let you know how things went. Bye. Good morning, everyone. I am headed to lecture. It is April 3rd. Well, not lecture. I'm headed to my exam. Exam 3 is today. I never feel good before an exam, to be honest with you, no matter what I do. But I'm going anyway. And to talk about Monday's simulation. That was technically the last sim, although we're back in 2 weeks for a medication presentation, which is a full day thing. But it was a pretty busy day on simulation day. We had meds to give, including a vaccine. We had a whole bunch of skills. There was a sterile setup, there was an IV pump practice, there was NG tube insertion and removal, and what was the last thing? I forget. And then we had our face-to-face on a cardiac patient, and we had a VR on mental health. So it was a pretty packed day, all day thing. I have been nonstop going through my notes. I just finished up my study guide yesterday, so at least this time I finished it, if that's progress. But I'm still not totally satisfied with the method that I'm using, because I felt like if I wrote it all, it might be better, but I'm not sure I do remember everything more than when I, use the computer. And not only that, but there's just so much information. I mean, how do you even remember all of that? I don't know. I really don't. I know one of the girls I'm in class with was using pictures and diagrams as a way of doing her study guide. I don't know, maybe that would work or not. I really don't. I'm a little deflated, very anxious. I have to do much better on this exam, but I don't know if I will. I am going just a tiny bit early. It's like 7:20 right now. I don't have to be there till 9, but I'm going a little earlier just so I can like keep reviewing my notes. Been up since 6, reviewing notes. I just don't know what else I can do. I don't know of another method to help me retain it more. I mean, there's just only so much time. It's not like I take a lot of breaks, so it is what it is, I guess. I just have to hope I do better on this one. And and then we'll have clinical on Friday. Hopefully we'll get to do some observations because we didn't get to last week. And we're nearing the home stretch, everybody. I mean, we just have this month is the end of the semester. So we made it that far. Oh man. Yeah. So I don't even know what I was gonna say. I'm gonna just go ahead and go so that I can like be with my thoughts and myself and try to calm myself down and try to get to a headspace that'll help me deal with it. But I'll talk to you guys later. I'll let you know how everything went. Bye. Oh guys, do you see this crescent moon? It's really hard to make out in the total pitch black dark, but look at that. It looks way more cool not on video. Take my word for it. Morning everyone. It is just before 6 o'clock on Friday the 4th, I think? No. 5th? I think it's the 5th. My watch isn't even registering yet because it's so early. It's on sleep mode still. I don't know how to fix that. So, exam 3. While I was doing it, I felt so much better than exam 2. I thought I missed about 10. And then when I got home, there was like a whole bunch of students talking in the Discord about the questions on the exam, and some of the things they were saying were not the answers that I had put on the ones that I thought I was right. So I was really worried that I bombed it again. But it turns out I did miss 10. So I got an 86.6, just like on the first exam actually. And that's great. So it brought up my overall grade in theory from an 84 and change to an 85 and change. So that's a little bit better of a cushion. Not so frightening now. I'm pretty sure I'm gonna pass the class. There's a few people that are not in that boat right now, so that's really unfortunate. And of course, a lot of them are people that I'm, you know, close with and stuff. So I hope they can pull out a B in order to pass. It's not the end of the world if they don't, but they would have to repeat the whole class, which is a big pain in the butt. So I feel good, but I don't feel good for those people. So moving on, so next week oh my gosh, the next few weeks we have a test every week. Next Wednesday for theory, we have an ATI proctored nutrition test that we have to get a certain grade or higher, or we have to retake it. So And it gets worse because the next week after that, then we have another ATI proctored test on fundamentals that we have to get a certain grade or higher. And then right after that, the next week is the final. So yeah, literally like 3 weeks left. And it is going to be a crazy 3 weeks, people. I mean, it's really bad timing to have a vacation scheduled right after class is over because it's really not the best time financially. But for my mental health, it's going to be just what I need to kind of just de-stress and come back down from the craziness of school semester and just be able to take some me time with my family. That is going to be great. And then also, as soon as I get back, I start working full time. So it's a perfect like intermission, even though it's not the best time financially. So that's something to look forward to. And actually, I am looking forward to working. I know it's going to be a very busy, dirty job that is just par for the course of this particular position on this particular floor. But I am going to be happy to be back to work. It's been, gosh, 8 years. Oh my gosh, it's been 8 years since I've worked because I've been raising a family. So, wow, that is just crazy to even think that I've been out of work that long. But to be making money again is going to be really nice. It's going to be totally different because I've never really had a job with having a family. So that'll be something to get used to. But I've never shied away from work. I've always been a hard worker. And on top of that, in pretty much any position that I've ever worked, I've worked overtime, which I'm also not a stranger to. And I'm hoping to maybe get some overtime at this job too over the summer, because I do not know what the fall is going to bring. I don't know how I'm going to do it. I'll talk about this a little bit later in the next couple of weeks or so when it gets a little bit closer. But you know, my kids, I really don't want them going back to this school. It's just been one thing after another. I get a phone call every week, at least once, from the school about someone got hurt. You know, one of my kids, one of the kids hurt in one of my kids. They bumped heads, they got pushed, they whatever, scraped themselves up. I get a call every week, or, you know, they're coughing too much, or they're running, you know, their nose is running too, I mean, it's just, it's endless. And it's not just that. It's a lot of their policies and procedures. Like, if we keep them home because they're coughing, then they don't get to participate in the attendance parties, like free slushies. So, like, in a 5- and 6-year-old, they don't understand that it's just, these kids get to do it and you don't. So it's just not cool in my book. And it's just been, you know, the projects that they get sent home with, the homework they get sent home with, they haven't even been taught in class how to do. They just expect the parents to teach. I mean, it's like, what's the point of having our children there from 9 o'clock in the morning until 4 o'clock in the afternoon if they're not being taught anything? I just don't. But anyway, I digress, rant over. So I am considering homeschooling my kids. They also really want to participate in sports and stuff. And like I said, it's really a bad time financially. And on top of that, I've got a full-time job I've got to worry about. And school is going to be restarting in a few months. So that is going to be chaos. I don't know how that's supposed to work. So there's a lot of things I've got to think about. But like I was telling my mom, because the way that she has always been is that she would look at all of these things and like as a conglomerate, as one singular problem that is completely insurmountable, and be overwhelmed. And that's how she's always been. And she was asking me how I'm going to handle all of these things, and I was telling her, I was like, if I try to look at everything as one thing, I would be overwhelmed. That's too much for anyone to try to figure out. But I was like, what I have to do in order to handle things effectively is put them all in little boxes, each individual thing, each of the ATI tests, the final, the kids, their activities, my work, my school. I've got to put all those things into individual areas in my head, and I've got to pull them down to be dealt with one at a time. So the best way for me to handle this is by not procrastinating, but handling things one at a time in a manageable fashion that makes sense so that I'm not overwhelmed. And that's what I explained to her, and she thought that that was a great plan because she confirmed what I had just said, which is that that's not how she did it, and it was overwhelming for her. So, and I know that because I saw it my whole life. So yeah, so today, sorry, I got off topic a little bit, but today for clinical, I'm really hoping we get to go to the ER because I went the one time and I was running around like a mad woman, but it's because I was on triage with my nurse. I'd like to do a little bit more of the care, like the ER care with like my 2 patients this time. So I'd really like to see ER again. I really enjoyed the busyness of the ER, but I would like to spend a little bit more time not on triage and more on patient care. So just to make sure that it's still something that I really enjoy, because at some point I am going to have to make a decision about where I want to go as a nurse, because I graduate in 1 year. I've got 2 semesters left after this one's over. So those are decisions I'm going to have to make. And next semester we're not really going to be doing what we're doing right now. We're going to be doing like maternal child stuff, so I'm not going to have another opportunity to do this at like an acute care situation until my final semester. And then by then you pretty much should know like what you want to do. This is where you like do all your experimenting. So the plan today is hopefully to get to the ER. I know she was looking for people for the OR. I'm not sure I'm wanting to go in there because I don't know, the parts of people missing could send me out. I don't know. I really don't. But I am on the main road. It is not busy, which is good. But I am going to get going for safety, and I'll catch up with you guys later. Bye. Hey everybody, it is Tuesday, April 9th. I just realized that I didn't finish up the video from last week, week 12. So clinical went good. I did get to go back to the ER, which was great. It was a totally different experience than the first time in the ER. So this is why it's so important to get more than one experience in each department, because you could have 2 completely different experiences in the same department. And that's what happened for me. The first time I was in the ER, I was super busy. We ended up with like 25 patients in the ER. I was on triage with the nurse, so we were like in every single room. She also had like her own patients on top of that. But I didn't get to see as much with them because we were so busy with triage. So, that was the first time in the ER. This time in the ER, it was dead. It was so dead. I mean, I say dead. We still had like 4 or 5 patients, but you know, up to lunch. But at the same time, to me, it was like, it was completely different because we saw like all 25 patients when we did triage the first time I was in the ER. And this time we pretty much had our own patients. We did help a little bit with triage, but not as much. But I mean, it was still really interesting. So even though it wasn't as busy, I mean, really the only time you're super busy is when your patient first gets admitted and you got to get them all set up with all their stuff. You know, blood work, you got to get the IV, you got to maybe take an EKG, you got to get the vitals, you got to get their history. So that's really the only time that it's like super busy. And then the rest of it is really just kind of waiting for results. So there was a lot of that this time. And there was a lot of downtime. So I was kind of surprised because I really thought the ER was going to be go, go, go. And I still think I really like it. I was kind of talking to the nurse I was with about, you know, what's required for the ER. You do have to have some specialty certificates and stuff to work in the ER. But I enjoyed it, even with the total difference. I mean, it's a 180-degree change from the first time I was in there. But I still think it's really interesting because you do get like different things every time, so it makes it kind of like a puzzle. And of course, you know, the more experience you get, the more ideas you have about what could possibly be happening when you see things. Of course, you can't diagnose as a nurse, but you still can have your suspicions. But yeah, so that was the ER, and we had a really good post-conference and a really good lunch, and kind of finished up the day. What else? Oh, I spent all weekend finishing up all the SurePath for weeks 13 and 14. There's nothing on week 15 because week 15 is the final exam. There's not going to be any lesson that week. Let's see, what else did I do? Oh, I finished up the last pharmacology on ATI. So that was on gastrointestinal. So I finished that up. I have the cat, sorry for the cat butt. I have my thing here. Yeah, the SurePath took a while. I finished up all the PowerPoints, which I think I discussed on Friday on my way to clinical, because there was like 2.5 hours worth of PowerPoints. Oh, so I finished up my assignments for clinical. And I had on here that I was supposed to start my medication presentation, which is due next Monday. I did get some work done on it. I'm really proud of it. Hopefully it's good, but I made a brochure because my subject is hypertension. So I made a brochure about prevention, basically, is what I'm focusing on my brochure. But I'll go through all the points when I make my actual presentation, which I think will be a PowerPoint, but then I also have to have a paper. And all of this is worth like 2% of my grade. So it's a lot of work for a tiny bit of results. So moving on. Oh, and then yesterday I also did the ATI Fundamentals Practice Test B. We have to do the practice test A and B with the review, and then retake it until we get an 80, and it's 2 hours of review. We have to take those. They're worth 0% of our grade, but we have to take them in order to sit for the proctored. So tomorrow is our nutrition proctored, and next Wednesday is our fundamentals proctored. So I didn't finish, but I did finish the original test, which is 60 questions. I did the 2 hours of review, and now I'm because I got like a 72%, which would be passing in real life, but they want us to have an 80 on the practice. So I have to wait 24 hours to retake the test. So I'll take that today, I think, or Thursday, we'll see. Depends on how much studying I get done on the nutrition, which is tomorrow. So our actual proctored exam for ATI nutrition is tomorrow. So I'm going to be working on that today. And then I can catch back up on the fundamentals retake later this week. And then I also need to finish up my medication presentation, which is due Monday. And then of course we have clinical on Friday. So it is a super busy week, but I wanted to finish up the video for last week, and then I'll start talking about this week tomorrow. All right, bye.